Welcome to this Cancer and Your Mental Health event. We are honored to be with you together. I'm Dave Fuhrer, the CEO of Gryt Health and also a two-time cancer survivor. This event that you're joining us for today is a full day of experts, advocates, and individuals who take care of others after a cancer diagnosis and also who have created their own identity and their inspiration in life. I remember after cancer first entered my life at the age of 25, I tried reading books and doing all kinds of things to learn how others had gotten through all of the things that happen to us after cancer first enters our life. I always came away, I think, inspired and seeing that there was hope, but not necessarily knowing what that meant for me or how I could do that. We've designed this series and this session today to give you a chance to interact with those individuals, to interact with others in the same situation, and to spend time together exploring mental health without potentially some of the concerns or even stigma we can face at other places in our life. We all together in this event understand what it's like to go through cancer, and we're honored to do that with you today. In just a few moments, I have the honor and incredible opportunity to introduce Nancy Sincata, who is a psychosocial oncology leader with the Leukemia and Lymphoma Society. Nancy will take us through a session about finding our new normal in the face of everything that we're going through currently. We encourage you to please interact, ask questions, make comments. And actually, why don't we start with that right now? There's a chat at the bottom of your screen. Why doesn't everybody just say hello? And if you can, let us know where in the world you're coming in from. Wonderful. So nice to see everybody coming in. We'll be here all day. There is a program schedule so you can see which sessions are coming up. We encourage you to explore that, as well as to check out everything that we're coming to you from inside this virtual cancer conference. Please explore the lobby and get to know some of our partners who have helped create this series together with us. You can explore the auditorium as the gathering place to watch all the sessions. And we now have a video vault where you can see recordings, not only from this series, but also from other individuals sharing their stories. I think I even did a TED Talk that's in there. Today is meant to be a day for interaction. It's meant to be a day to help us get through everything we're facing, not only after cancer, but through this incredible time that we're experiencing now. I need to say a huge thank you to our team with Gryt for bringing this to life. We are an organization that was started by cancer survivors, caregivers, and advocates, and we go through all of the same things individually as we do in creating this conference. It has been really real life bringing it together with everybody, and I'm so grateful for their support. I also just quickly want to say thank you to all of our partners and everybody who created this series with us. This is episode 5 in a 5-part series. All of the previous content is available on the screen you're accessing currently, just below the fold. Please check out some of the most amazing sessions. It's open 24/7, so wherever you are, you can go back and watch anytime you want. And finally, as a survivor myself and a caregiver in my family, it's not always easy for me to talk about the things I face, even though I do this work. And so I'm part of a session with Dr. Catherine Benedict coming up shortly, sharing a little more about the things that have been harder for me to express. I'm honored to get to do that with you. I'm honored to sit here and listen and participate with the speakers and the panelists that are coming up today. And I'm grateful that we get to spend this time together. I'm honored to turn it over to Nancy to start our first session. We'll be here all day today and look forward to what's ahead. Thank you, everyone.
Hi. I also want to, I see that there's already 41 people on the screens. So thank you all for coming and for getting up in the morning. I always think when I'm talking to groups that people who arrive are already people who are the people who in some ways are coping the best because they've been able to come and access a program. In the middle of a quarantine, maybe that's a little bit different because maybe everybody is home and this is a good diversion to quarantine time. So welcome everybody. And I want to say, so I am in New York City, and I appreciate that although we will allude to the pandemic, and I think that there will be questions about it, I don't want in any way to minimize anybody's experience. I know that people have been affected in very many ways, that some people have been sick themselves, some have had loved ones who have been diagnosed with COVID, and some people have experienced losses. So even though as we talk about the pandemic, I maybe not with the gravity that every individual faces, I want you to know that certainly we are all in this together and in this with you. And I think what a complicated journey we're on. And I also think that um, none of us can claim the expertise of really knowing and understanding how to deal with things in a pandemic, because none of us have been here before. So again, I appreciate who you are, what you have been through, and what we're all going through together. I think that just to let you know some of my experience, I have been a social worker since 1979, and I was a child life specialist before becoming a social worker. And my mission has always been connected to people with cancer, primarily children with cancer and their families. And I have had the ability to be involved with group programming from very early on in my career, and have been able to develop a large group model of practice, so that you will hear my bias during these next few minutes about your own potential involvement in groups, regardless of whether you are a person diagnosed with cancer, a parent, a caregiver, a spouse, a survivor, so that we will talk about that a little bit. Always when I'm doing things in person, I sometimes have the ability to hand out a little survey to people, and one of the questions that I ask is what you have learned about yourself on your journey. And it's really interesting to me because the predominant group of people in that forum have been parents of kids with cancer, and I've been struck by the fact that the majority of people will always talk about what they've learned is about their own strength and their own resilience. And if you think about it, if someone were to say to you before you had children that you were going to have a child that was diagnosed with cancer, or before you were diagnosed yourself that you were going to be diagnosed with leukemia, like what would your initial reaction be? Even in many cases, the thought would be, I would not be able to deal with that, right? Like that I could never imagine having a child in that situation, or that I could survive that experience. So I'm intrigued to understand about what happens between the time when you're diagnosed and then when you're living and coping, and in many cases thriving with the diagnosis. So I would love if you would, in the chat box, and again, this is new technology for me, so I appreciate your bearing with me on this, but I wonder if there's anything for anybody in the room or in the virtual room who has learned something about themselves, or has been able to do something that they never imagined that they could do. So if you find yourself in that situation, if you would type in to the chat box what it is that you have learned about yourself in this journey, or what it is that you have been able to do that you couldn't have imagined doing. I know number of people who've actually gone on to nursing school and medical school after having the experience of being a caregiver for a child with cancer. And I think that I'd be interested to see. Now, if you don't have anything that you have learned or that you've come to know about yourself, I see that um, somebody just, I think, is typing in now. So that's exciting to me that there really are people out there and people typing in. So thank you. this person is saying that I've learned that it's okay to ask for help. And actually, even though I have set this up in such a way that I have 20 questions that I wanted to address with you, I also want to have this be interactive. So as I hear things in the chat, I want to express them. I think the thought of learning that it is okay to ask for help, and actually you help the people around you when you ask for help, right? You not only help yourself, but you really help people who want to help. And there's an interesting thing in life. I've done a lot of work on the study of hope, and it is interesting to understand that people who are helpful actually become more hopeful, and people who are hopeful can be more helpful. So I think there is kind of a nice combination of those things. I think I may have missed a question. Uh, Finding words to express things I was embarrassed about or didn't think that the world would understand. So I think that's kind of finding a way to be in yourself, to be able and to be willing to express the things that um, you imagine that the world wouldn't appreciate, that um, that you had known. So you think about what happens at the time when somebody is diagnosed, right? And you think like the whole world changes. And as we talk about what the impact of a cancer diagnosis is, in some ways, what I have found over these last 6 weeks is that many people that I know who have been through a bone marrow transplant, have been through an intensive chemotherapy experience, who've been in isolation before, understand the concept of isolation in a way that many people who have not experienced illness have never had to deal with. And in some ways, I think many of us have been looking towards people who've been on this illness journey for advice and help in how it is you face the world when in fact you can't be in the world in the same way that you knew about. And I'm not sure that it is this experience for everybody, but I've had a couple of young adults say to me in the last couple of weeks that they actually feel like they are thriving a little bit because some of their friends and some of the people in their world who did not previously pay so much attention to what they needed to do for their own health needs are now paying attention to those things and expressing their own ways and fears and concerns about that, and that the people who I know who've gone through treatment are actually really able to be helpful. I have one young man who spent a year in the hospital post bone marrow transplant, and he said that this is the first time in his life, because everything is happening virtually, that he actually can work overtime hours because he has the stamina to do it, because he doesn't have to do any of the traveling, and that he also feels as though he is understood by his cohort of friends in a way that he's never been understood before. So those are kind of interesting things to think about, how it is that people who are dealing with cancer learn to live in an altered world and learn to cope in that world. So I think that it's interesting to think sometimes people don't recognize the strengths that they gain and the skills that they grow with during the time. You know, when you're first diagnosed, you find yourself in a club that you don't want to belong to, never wish to be part of, and then you find sometimes that you make connections and find camaraderie in this club, that it is a place in some ways that you don't want to leave once you have gotten there. Um, so I see something that says, I so agree, other people being in isolation and with high anxiety right now is the kind of like, I'm thinking, welcome to my world. And I think that the interesting question is, what does it mean for you in your world when other people have entered it? And when you think about the talk about reopening the country in a way, right? Like how that has an impact on you, because I think some of the questions and some of the things for people to be prepared for is that other people may feel more free about being back in the country post this phase of the pandemic, and it may be more threatening for people who are undergoing treatment or have had the experience of being someone who's had to deal with cancer. So I think that there is connection now. And then my thought would be to be prepared that as that changes, there may be some disappointment as well. And in fact, you may understand more about the people around you then, and it may be that people are as connected and as helpful and as understanding as they are now, but it's hard to understand what the long-term reaction to the pandemic is going to be. It's also interesting to think when you're first diagnosed, right? And you think about in most cases, there is a dreaded feeling about being diagnosed with cancer. In some occasions, when someone has had symptoms for a long time, there is some relief in the diagnosis because you know what's going on and then you can finally move towards treatment. But if you think about those beginning weeks and how unfocused and vulnerable you feel, it's interesting to think about the pandemic in that way as well. We really are only 6 or 7 weeks into an experience, and I think that everybody is feeling as though they should be able to cope with this by this point. They should have mastered what it feels like and what the experience is like, and to really think about it from a mental health point of view, like this is really, really early, and it takes at least this first 6 to 8 weeks to even adjust and let yourself understand what's going on. And I think that's similar to the diagnosis at the beginning. It's also interesting to think about, so what happens in a family when you're diagnosed, right? And you think about, let's take the example of being a child is diagnosed with cancer and what happens. Generally, if there are two parents in a situation, one parent, even if both parents are working, one will leave the work that they're doing to be able to be the caretaker for the child. Some of the responsibilities in families will change, and as people change and as responsibilities and roles change, everything, the homeostasis of the family changes, and everything in the household takes a period of time to adjust. And during that adjustment, people learn things about themselves and about their other members of the family. So I think that regardless of the age you're diagnosed with cancer, those are that you can expect that suddenly everything changes and everything may change dramatically. And even though some of those things go back, there is that whole question about what the new normal is. And I wonder if in the chat box we could have some discussion about what the new normal was for you when you were diagnosed with cancer, if you're somebody in the audience who was um, diagnosed with cancer, or if you're a caretaker of somebody, what was the new normal for you? We've come to know that phrase again in the cancer community. It almost feels like in the pandemic community they have taken over the use of that phrase, but that's a familiar thing. So how did your world change? What was your new normal? Somebody wrote that they quit working, so that's a big deal change. And I apologize as I go from screen to reading that you may this person says that my dad and I were much closer because he became the person who cared for me in a way that has always been my mom's role. So interesting to think about the connections that you make and the ways in which life changes that have positive outcomes for you. I also think that in thinking about how you take care of yourself and ways in which you pay attention to who you are and what you need become actually hopefully things that you will carry with you through the rest of your life. I think that sometimes we work so much and travel so much and do so many things that we stop paying attention to some of the simple things um, around you that before wasn't. And sometimes those difficult things, right? Sometimes, someone is posing issues about fertility issues and then divorce and chronic health issues. So there may be a whole host of things that you have to deal with. One of the things that's really important to understand and sometimes difficult to understand is that if before you found yourself in the cancer world, there were certain issues that you were facing or certain mental health issues that you had or certain family problems, generally it is not that the diagnosis then makes those things better. But it is true that sometimes what happens with the diagnosis is that it gives you access to help and to support from other people that you may not have had. Um, I've had people who have celebrated even some of the negative things because perhaps before the diagnosis they didn't have the courage to deal with the issue that they knew that their relationship was not working, but it became much more apparent and much more exacerbated during the cancer journey. So that I think it's interesting to think about the things that happen during the journey and the ways in which you then integrate those things kind of into your soul, right? I think that people change, and in many ways it is not only you that changes, right? That it is the people around you who change as well. The new normal for me is accepting permanent side effects, and I think that's a very important point, that there may be things that are now permanent for you, and how do you again cope with those things and embrace who you are and what you can do while still allowing yourself to grieve the loss of the things that have happened to you along the way. I think that somebody raised an issue that they felt like their life was totally different. They changed careers, gained and lost friends, got a new best friend, and unfortunately a new anxiety. I think new anxiety could be the word for the world right now, and maybe in fact help for issues around anxiety will be the thing that we see developing in greater, in the same way that they're looking for drugs for the pandemic. I think that we're going to be searching for the ways in which we help people with anxiety. I want to stay on that issue of a new best friend, because something that is really interesting and really consistent in the work that I've done with many populations is that friendships change, right? And when you think about it as an adult, you don't necessarily in life think about these periods in time when you evaluate your friendships, right? I mean, your friends are your friends. Sometimes they've been with you for a very long time. When you're in a relationship with somebody, it's not uncommon, right, to some break up with somebody because things change in a relationship, and we expect that. But in friendship life, we never really think about evaluating the friendship, breaking up with a friend. Sometimes things just happen, right? And I think that it becomes important to think about why things during the cancer journey happen, right? Many people, excuse me, have the experience where they feel more disconnected from their friends and sometimes from family members, but they feel a sense of disappointment, right? That there are people who they anticipated would be with them in this journey and who, in fact, didn't come through for them. But yet then they have this other experience as well, right? Where people they would not have expected to be there for them, people who've been in their life, but they've not expected to be there for them, then emerge as the hero in their life, the person who's able to be available throughout periods of sickness or isolation or loneliness or depression. And it is amazing to see who those people are who emerge in those roles. And I think that in lieu of the disappointment people may feel with some of their pre-existing friends, there is a remarkable feeling of strength, love, connected to the people who emerge in these supportive roles. And I think that it's important to think about, sometimes it feels as though it is um, your friends who are not available and that they are the only people who have changed. But in fact, it's important to think through that you also are somebody who has changed, right? And many relationships are really built on the patterns that people have developed together over time in friendships. So when something changes for either one, it makes sense that then there are changes for both. So I think that one of the interesting things for this cancer experience is it actually has you evaluate the people in your life like nothing else does. And people often emerge with stronger and different relationships. And then there are the people that people meet in the cancer community. And I know that there are really remarkable relationships that have happened. um, was that, and I think that again, I'm seeing somebody saying um, that they understand that their cancer experience was the reason that they ended an unhealthy relationship, and that was a good thing. And I think that that's one of the things to hold on to, that in fact, even though there are changes and even though there are things that certainly seem sometimes to be negative things, that they sometimes have positive outcomes. I also think that the whole experience of having cancer is like a very, very big opportunity in life for you to think about who you are, what you're doing, who you want to be, how you want to interact with the world. I'm seeing that there's some more things coming up on the chat. Some people are talking again about some of the good friends who have not checked in, friends that um, that there is an understanding that it is uncomfortable for people to talk about cancer. I think if you think about it, when we all go through many years of education, we all have a primary set of years of education, but never in any of that time is there something that teaches us what do you do in life when your friend gets sick or when your friend gets diagnosed with cancer. And I think that it's interesting because in some ways it really may be a learned skill, and maybe once you've had the experience you become the people in the world who reach out to other people and teach people things. But I also know there is a frustration sometimes feeling like I'm going through this. I don't want to have to take care of other people or teach other people. Some people are saying that they've not made friends within the cancer community and they feel like they've missed out on it and they don't know how to change it. Well, I think there's some interesting things in that to think about. There are ways to become connected through cancer organizations. I'm going to do a little plug for the Leukemia and Lymphoma Society, and when this conference is over, there will be resources for you to look at and to find out. Many people create friendships with people who have similar diagnoses, and they find those relationships both in when we're not in the middle of a social distancing moment, in live group programs and programs offered by various cancer agencies and community agencies and hospital-based programs. I also think that many people connect with each other on the internet, on the various different programs that exist for people within, again, a particular illness community. And some of those relationships are born out of not just a sense of isolation and loneliness, but out of seeking information, of wanting to know the most there is to know about your diagnosis. So people come together often around seeking information. But the other thing that is true for many of those illness communities is that they are both nationally and internationally based. So if you find yourself up at 4 in the morning with no one to talk to, often if you go online, I mean, it started out as kind of a listserv community, and now I know that there are many more both online and internet forums for people that you will almost always have somebody who will answer you. So my message to you would be to seek out resources. Sometimes when you're going through the cancer journey and you are doing well and coping well and you have a loving family and great friends, you feel like you don't need to reach out to the community of cancer resources. But there is something within that community that is remarkably helpful, and I think engenders a kind of support that you don't even know that you don't have until you have it. So I would really do the plug for talking to the professionals in your life and looking at things on the internet and finding communities where you can actually have the ability to create those relationships. And some of that comes within the context of special programs. And I know that sometimes people also feel like I don't need the resource of a special program, but I want you to think about why some of those programs have developed in the cancer communities, whether they are outward bound programs or they are a theater group or things that you wouldn't necessarily think of. For me, retreats for families in which somebody's been diagnosed with cancer, that those experiences hold within them a kind of communication and a kind of emotional connection that is really hard to describe if you haven't experienced it. But once you have experienced it, I think that people feel as though some of the benefits of getting cancer, if you can look at it that way, are to become connected to people and to have some of those special experiences which you just might not have had in your busy, crazy life. I see somebody saying they feel a bit of guilt that my husband has to go through all this with me. And you can't help but feel like he's getting gypped. You know, I think sometimes we all have those feelings, but I do think that um, that I'm going to go back to again why sometimes special programs are helpful things, but also to know that for many people, being able to be supportive and helpful is one of their life's greatest strengths and brings them both tremendous joy. And I think that there are ways to create joy in life and fun and interesting things while you are going through this experience, and maybe taking more time to be connected to the people around you. So maybe he has to go through these things with you, but maybe there are also benefits in the emotional um, connection. So I also think I'm reading another thing now. Something I've done over the years is to make sure that I do reach out to people outside of my family so I don't lean on them all of the time. I think that again, it is great for you to find opportunities for people who are going through similar experiences, but also remember, whether it is your husband, your parent, your child, within the context of those experiences with other people in the cancer community, are those other people as well. So I have to tell you, like one of my favorite things is this group of fathers groups that I have run for parents of kids with cancer, with men who feel like they don't talk to other people about their issues, they don't connect with other people, yet they come to this space and they are so excited to share the feelings that they have, because you can start to feel like you're a little bit crazy when you feel like you're the only one who feels something. So an example of that would be, you know, a lot of people are affected by cancer at all different ages. And when you are affected kind of in the middle of your career, or at a time when you are pushing hard with your ambition to move forward, and all of a sudden something happens in your family and you no longer have that ambition, it is almost as though you feel lost because what has driven you thus far is not there emotionally for you. So I think that sometimes coming to a group and hearing somebody else say that they've had that experience and now they're more interested in playing frisbee golf with their children than they are at getting that next promotion at work does in fact allow you to feel like it's okay to feel what you feel and to think how you think. And it doesn't mean that you're depressed. It doesn't mean that you're going crazy. It means that you are reacting to the experiences that life has given you, and you are maybe becoming more connected to the people around you, and your priorities are changing, right? I think that we would all think, whether it is the cancer diagnosis or now whether it is the pandemic, that your priorities change in this experience, and what was important to you on March 6th this year may not be what is important to you on May 6th as time goes. So as we think about all of these things and we think about ways that you can help yourself and help other people, there is a real message and I think you'll hear it over the course of the day, right? In allowing yourself to feel what you feel. That sometimes I think that we are burdened by not allowing ourselves to be reactive or to feel the things uh, that we feel. I'm reading a question now that says, how do I introduce myself to young midlife professionals with whom I would identify when I no longer work? Well, this is the question that has so many different layers to it, right? I think there's a question about, um, is you're no longer working temporary? Is it something that is going to be true forever at this point? Is it that you are changing careers? I think there's an interesting question of, again, the essence of who everybody is, that sometimes we define ourselves by our work, but in essence, we are who we are, and there is that formulation of who we want to be, and maybe after cancer, we are more likely to have a truer sense of who we are and how we want the world to see us. So I think that the world is very accepting, but we may not always feel like we can put ourselves there. I mean, I think that there's a big lesson happening with the pandemic. There are going to be many people who come out of this who are going to be doing different things. And I think it becomes an interesting question of, am I doing something different now because of the pandemic, or was I moving towards doing something different before, and the pandemic is the thing that pushed me to be there? So I think that there's a sense of being your true and honest self, and that the world will embrace you in those roles, but you have to be willing at times to put yourself out there. I think that there are many resources out in the cancer community that I would again recommend that you avail yourselves to. And I think that you may face a whole host of issues and disabilities that you had not faced before the diagnosis. And I think that again, there are people there who can be helpful around those issues. And it may be that you are redefining who you are because of an experience you have that limits your ability to do something that you had previously done. I would think it would be of help for you to help understand for yourself the things that you can do and the things that you are able at this point to do and what you want to do. And again, I think there are people in many of the cancer communities who are there um, who could help you with that. I see that what this says, and I think the big thing that comes out of this for me was a sense of empathy and compassion for others, especially people we know nothing about. And I think that that's a really important thing, right? That you are you are more compassionate for others, and I think you see in others their strengths. And I think within the context of your own resilience and your own struggle to have coped with something that challenges you on a level that other things don't challenge you as much, that you find, a part of yourself. Many people spend many years searching for something and thriving, yet feeling not completely at peace with themselves. I think that sometimes the emotional work that you do during this journey gives you a secret about life. It kind of enables you to be who you are, who you want to be, and to do what you need to do in the world. And maybe everybody is in some ways looking um, for their own personal mission, right? Like if you were going to write your own mission statement in life before cancer and then after cancer, I think that you might find that it would be a different, a different, um, it would be you might see yourself as a different person, but you were always that person. It was just that this experience allowed you to grow in even greater capacity. I'm a little bit wondering about time and where we are with time. So is somebody from the the greater Gryt world would let me know where we are with time, I would appreciate that. And okay, so we are coming down the runway here, and I was thinking that I wonder if in the chat box, if you would be able to type in advice that you have for other people based on your experience. And if you are a cancer survivor, you could identify yourself that way, but you don't have to. But if you're not a cancer survivor, if you are a medical professional, I would appreciate if you would identify yourself that way as well. I also want you to know that there will be resources available to you and that there are organizations out there to help you. But in fact, also want you to remember that you are people who can help other people, because in fact you have been through something and you are survivors. And I think that that again, you have ways in which you can reach and touch the world. And I see somebody saying, I wish I was a cancer survivor. And I think that sometimes we need to think about today and the way in which we are interacting and touching people's lives today. And I think that if nothing else, this pandemic has shown us how quickly life can change, and life can change for everybody, and that the acts of kindness and compassion that we see in the world are really important to hold on to and to be part of. And I don't know if the chat stays around for people later in the day, if people can access it. If there are questions and things, I realize now, like, there's a million things that would be fun and interesting to talk about. So maybe we will come back in this Gryt forum
Nancy,
again to do that.
Nancy,
But
can I
yes,
chat? Nancy, can I chat with you for just the last couple of minutes?
absolutely.
Oh, thank you. What you were saying about putting ourselves out there, and I was reading comments that people were making in the side about, how do I find happiness and when I'm searching for something, meaning in life. And that was so true for me. I remember how terrified I was in the beginning to start saying the things that I was really feeling inside. And when you said to put yourself out there, I went back to how scary that felt to first
Hmm.
start doing it. And I was really surprised how many people would say to me that it took strength to do that, when at the time I thought I was doing it out of weakness. I couldn't hold it in
Hmm.
anymore. And so now looking back, that's been almost 8 years for me, 7 years. And now I look back how much my perspective has changed, but just how much I was convinced that I had to hold all those feelings in. So I just wanted to share how much that your comments and then reading the chats affected me.
Well, thank you. And thank you for saying that. I'm so aware also, sometimes people, again, using the group modality as an example, people come thinking they don't want to participate, they don't want to say things. And in fact, what happens is by the end of the time, they are so both relieved and excited to be there that they don't want to leave at the end. So I appreciate what a complicated experience, the living with cancer, letting people know how you feel, taking initiative to be connected to other people, and then doing it during a pandemic is. So I appreciate the opportunity to talk to you, and I look forward to other opportunities. I realize we are ending in time. I appreciate everybody in the chat, and you will have my contact information if anybody wants to have a further discussion. So thank you, everybody. Thank you for inviting me.